do a proper stool analysis motion test to the patient. The patient may need an endoscopy or the patient may need colonoscopy. Endoscopy means nothing but if you are going to put a tube through the oral cavity to see the proximal gut, which means from your foot pipe to your stomach as well as the proximal small intestine. Apart from that, you can do a surveillance through the lower GI tract, which means predominantly your colonoscopy. So, which means the gastroenterologist is going to put a tube through the anal canal. He is going to see the entire length of GI tract, as what I showed in the previous slide, which means entire length of the lower GI tract. It's nothing but your colonoscopy. In case if the patient is having problems which is predominantly located in small intestine, as I already pointed out, the length of small intestine almost around 6 meters of chart. It's very difficult to see the problems is happening in the small intestine just like that. Because small intestine to access completely, it is a very difficult task most of the time. So there are so many investigations are there. It's nothing but your enterography, your enteroscopy, your capsule endoscopy. So many investigations are there. So it's not my intention to breach each and every area, but you should remember that what do you mean by enterography, which means if you're going to do a imaging, as any scan, your CT scan or MR scan, if you're going to do a scan to identify a small bowel, it's nothing but enterography. If you're going to put a tube through the mouth and you're going to see something which is happening in the small intestine, like your endoscopy, it's nothing but it's called as enteroscopy. It's nothing but antegrade enteroscopy through the oral cavity. You can also do retrograde enteroscopy through the anal region. So you can use enteroscopy biphasic. You can identify either through the oral cavity or through the anal canal. Depends upon the clinical presentation, what you're going to see. Why I'm pointing out all these things, your basic blood profile, your basic assessment is important. For example, certain things, even patient side, you should not miss. I came across with a young girl who had evidence of bloody stools. And probably, I think so, she's coming from nearby source of Vilupuram or somewhere else. The parents didn't notice that significantly and they are treating her with just like that. It's piles with a physician elsewhere outside. So what happened to the girl? She landed up with severe anemia. Anemia means severe means what? Which means the hemoglobin almost gone less than 5. And she landed up to us. Why this kind of presentation? I was wondering why such drop, such young girl, 20 years of 20 to 22 years of age, who had evidence of significant blood loss, followed by the patient being visited to us. And the bloody stools was not that severe, but it is happening quite slowly over a period of time. We don't know significantly. When I examine the patient, usually we need to look for evidence of GI causes. It might be, as I already pointed out, there are so many reasons for a GI problems to happen. It might be simple pines, it might be a simple fissure in ano. So many things are there for the patient to land up with evidence of blood loss. And we had a clinical suspicion that there's high possibility for this patient to land up with evidence of inflammatory bowel disease, considering there is significant weight loss, alarming punctures like bloody stools, and we did a colonoscopy. We identified the patient as evidence of Crohn's. Why I would like to point out, if you are going to see blood which is coming anywhere in the GI tract, you need to report to the gastroenterologist immediately. Whether it is vomit which contains hematemesis or whether it is bloody stools which is nothing but your hematochezia, or if the patient is having black colored stools, which means the bowel, the proximal gut, which means the small intestine will be having predominant source of your blood loss rather than in your distal gut, which means either your stomach or the proximal bowel. If there is more traces of your fresh blood in the gut for a longer duration of time, there is high possibility for the blood to turn into black color, which is nothing but your melena. If the patient is going to land with more of melanic stools, which means tarry black, you might be seeing the color of a road tar. It should be like a jet black color, which means the patient having evidence of blood loss somewhere else. So you need to be aware if the patient is landing up with this kind of evidences, then there is high possibility for the patient to land up with evidence of some complications in the GI tract, possibility of inflammatory bowel disease in the ISL. So you need to recognize such patients immediately. So what is supposed to do? If the patient is having more blood loss, the patient may be agitated, the patient may be diaphoretic, which means the patient may have more tachypnea, tachycardia, the patient pulses may be feeble, the patient may have more breathing difficulty, the patient may have palpitations which is happening in the heart, the patient may be having more distress and more irritable and lethargic and drowsy. She couldn't able to walk, she couldn't able to climb, she couldn't able to step up and step down. They might be having major issues will be there, which is happening because of anemia, the blood loss and the hemoglobin which is dropping. If you're not recognizing this kind of scenario in right time, the patient may lose the life. So you need to be very cautious to recognize this presentation in an earlier phase in order to treat the patient promptly, in order to give a potential life to the patient. Because even though the treatment for inflammatory bowel disease, it's a longer duration of time, it's a chronic entity. It doesn't mean you have been treated a patient for IBD for a duration 2 months, 3 months. The problem, the symptoms have been improved to some extent. But that doesn't mean that the patient have been completely cured of. So you need to be very cautious. You need to recognize, you need to have a serial follow-up with the gastroenterologist. Even though if the patient is asymptomatic, that is very important. Your surveillance, your screening, all those things is absolutely important to recognize your problems promptly. To the general public, what I would like to address, even though if you are going to get diagnosed with inflammatory bowel disease, most of the time, this very commonly reported scenario in Indian population. Why? Because the treatment guidelines for this condition, for example, if the patient is having inflammatory bowel disease, there are huge list of treatments which is being available, starting from the basic molecule called steroids, your biologicals, immunosuppressive therapy, and even with the best of costliest medications are available in the field. But the problem is, each and every treatment might be having some adverse events. The patient may not be aware about that. The mistake is, before starting the treatment itself, the patient may need to check with a complete blood panel whether the patient is having any evidences of any infections. For example, if the patient is having coexisting tuberculosis, or if the patient is having any evidence of herpes zoster, which means skin lesions, all these things, so many reasons are there. Your CMV, cytomegaloviruses, Clostridium. I don't want to talk each and every aspect. Very importantly, if you want to start a treatment to the patient, prior to that, you need to do a basic checkup to see through that the patient is not having any major catastrophic infections. So we need to rule out. So it will be a funding. The patient may need to spend more and more money in that area to work up. That is why in Indian scenario, it might be a difficult task for most of the patient to achieve a good treatment guidance. Recently, very recently in my practice, I came with a patient who is around 45-year-old female who had evidence of severe inflammation in the gut, which means severe colitis. And I'm very sure that the patient is not financially good. I tried my level best to help the patient. I have done the colonoscopy with reasonable justification. We have diagnosed a problem. We have made an attempt to treat her. But the problem is, before giving certain medication, she need to undergo some investigations for sure. And she may need to take some vaccine to protect her from infections, for such catastrophic infections. The problem in Indian scenario, the vaccines might be around 10 to 15,000 of cost. It might be very difficult for the patient to afford. But if you're not going to give certain vaccination, if you're going to use certain medicine, there is high risk for the patient life. The patient may lose a life. So such things is very commonly reported. Most of the time, the patient will not report. They will seek the opinion for another doctor. This is what is happening in India. You should not miss out the scenario. If you have been diagnosed in the government centers, wherever the center, you need to have a proper workup. It should be government funded. The government should give a proper fund and all those things in order to diagnose such events properly and to start on some medications. There are so many medications are there. It doesn't mean only steroids. As I already been discussed, some injections are very costly affair. There are some injections which cost even in lakhs. Do you think it's easy? Most of the patients, our society, middle class populations in the higher side, it might be a difficult task for them to afford. And one more thing, even with the gastroenterologist, the problem is, even if the patient is starting the treatment, it might be a difficult task for the gastroenterologist to say, so you are started the best treatment. So you will be responding best. It's not possible at all. Because even for the best of gastroenterologists, it might be a difficult task to say that the patient will respond to the treatment. Even gastroenterologists will assume. So we would like to go with this kind of treatment. If the patient follows the medication properly, there is high possibility for the patient to respond. But whether all the patients sticking onto the guideline, no. The patient may lose the hope on doctors, may lose the hope on the lives, may lose the hope on God, though they'll be having multiple seeking of further another doctors. Again, the basic workup will be going on. This is what is called as doctor shopping. They will be frequently happening in the field of gastroenterology because the molecules, the treatment guidelines, what you're going to use before that and post that doesn't mean the patient will respond to the treatment completely. The patient may need adequate knowledge about that, and it is the duty of a doctor to educate the patient accordingly. And why I'm pointing out all these things in this video, and whoever is going to have a look on this scenario, it is very tough to identify. It's very tough to counsel a patient to stick onto the guidelines. And even though if the patient is having, coming across, even the patients are from affluent family members, they may not afford for the treatment. Suppose if the patient is going to have a major blood loss, they are going to initiate the treatment. So what is going to happen? Within 1 month, 2 months, the symptoms will improve. The blood loss will come down. Suddenly, what will happen? Even with affluent member, they will stop the treatment on their own. They will not visit the gastroenterologist again. So what will happen? The further scenario will get worsened. So always you should remember the proper screening, proper diagnosis, and the initiation of treatment with serial follow-up. Whether the patient is responding to the treatment, even the doctor doesn't know in initial phase. Only during the follow-up with the patient, how the patient is going to respond, whether the patient is improving in weight, whether the patient bloody stools has improved, whether the patient loose stools has improved, whether the patient tummy pain has improved, whether the patient quality of life, whether the patient can able to go to school, can able to go to college, can able to do the work, can able to climb up and down the stairs. All these markers. This is not a blood marker. This is not a clinical. This is what is called as clinical recognition. This is the duty of a doctor for us to diagnose you whether you're responding to the treatment or not. That is very important, which is very difficult to recognize in Indian scenario. That is why inflammatory bowel disease is a challenging entity for all the major population, not only for Indian population, even for the westernized population. If you're not going to adhere to the guidelines and with a serial follow-up, if you're going to miss it out, there is high possibility for the patient to not responding to therapy will be in the higher side. So serial follow-up is most recommended. Before taking on, basic important thing is, as I already been discussed, multiple things have been discussed in this area. Crohn's disease is a problematic entity. The patient may have multiple complications like fissure, fistulas, sinus tract, more pain in the periumbilical region, all these pointers, and it's very difficult to treat because it's the inflammation will be more deeper in your Crohn's rather than in your ulcerative colitis. You should remember all these pointers is more than enough. But what I would like to say, so these are all the pictures you should not forget. Your loss of appetite, bloody stools, fatigability, fever, oral ulcers. There are so many markers. So for example, if you're going to have a treatment, this is what is called as extra GI markers. The patient may have jaundice. Suddenly the patient may develop high discoloration of yellowishness in your eyes. Suddenly the patient may have joint pains. The patient may have multiple joint pains. The patient may have sudden back pains, nothing but your ankylosing spondylitis may develop. Or the patient may have skin lesions. For example, suddenly the patient is having eczema like presentation. So many skin lesions are there, pyoderma like presentation. So many things are there to look for your skin presentation. Like extra GI, starting from your head to foot, the patient may have other manifestations, cardiac, neuro, blood manifestations, your liver manifestations like jaundice, multiple manifestations may happen if the patient is having inflammatory bowel disease because it is a multi-system environment. It doesn't mean only one system is going to get affected. That's nothing but your GI. It might be a multiple other systems may coexist. This is what is called as extra GI manifestations of your inflammatory bowel disease. You should not forget that. And I think I've been discussed all those things. So what are you going to do for the treatment? Always remember the diet is important. High fiber alone is not the best of treatment. You need to go for fiber supplementation of reasonable proportion. Processed food, deep fried, junk foods, restrict a lot, avoid smoking, tobacco, alcohol, all those things. Physical activity is a must. If you're overweight, control your weight. Diabetes, hypertension, thyroid, your cholesterol, all those parameters should be in good control if you want to address this properly. And you're exercising. Low FODMAP diet, which means there is such a component called anything which is too much of sweetness. For example, too much of, for example, if you're going to take too much of bananas, that may harbor a worsening of your gut. If you're going to take too much of, there are components what's called as high fructose, sucrose, and all those things. And lactose, high lactose component. For example, if the patient is going to take too much of dairy products, for example, milk, coffee, tea, and all those things, that might be a precipitating factor. It will be a trigger. So the diet should be in balanced proportion with reasonable amount of carbs, your fat and proteins. And you're not supposed to go for too much of fat or too much of carbs alone. Balance should be in all. And as I already been counseled, fiber proportion in reasonable way. And apart from that, deep fried, junk, processed, soft drinks, hot drinks, your beverages, all these stuffs you need to reduce. Carbonated drinks, sources, and processed food items, you need to restrict a lot. This is what the basic thing about the diet to address. And already been pointed out about these are all the basic diet pattern. Huge list of diet patterns are there. Your Mediterranean based diet, which means unprocessed foods, healthy fats. You need to go for that. And rather than going for more of unprocessed items, apart from that, this is what the basic ideology about your diet modification. And regarding the medical management, depends upon your presentation, depends upon your severity, after your clinical assessment, after your laboratory assessment, blood parameters, after your endoscopic assessment, as I've already been said, like your endoscopy as well as colonoscopy or as enteroscopy, depends upon the clinical presentation. So we need to diagnose you whether you're landing with evidence of inflammatory bowel disease In inflammatory bowel disease, whether you are going to land up with evidence of IBD, UC, or CD, which means ulcerative colitis or Crohn's, based upon that, you need to initiate huge list of molecules. I'm not going into the discussion about that. And in India, there is reasonable funding for all the molecules, but we need to augment in that area also to aid most of the poor and needy population to serve in a better way, to be served in a better way. Apart from that, very importantly, once if you're going to initiate the treatment, as already been discussed, your weight, nutrition, your mental stability, physical stability, social stability, your weight, apart from your bloody stools, loose stools, all these parameters has to improve. Then only you are growing well. Your health is well. What do you mean by health? Physically, mentally, socially, all these parameters has to be in equal formulations. It has to improve in all the domains. Then only you're physically fit, mentally fit, as well as socially fit. It's not only the physical component alone. So doesn't mean if you're going to gym for all one day, doesn't mean you are healthy. You understood the concept? So, physically, mentally, socially, you need to improve yourself in all the spheres to address this component effectively. So, the patient need to be counseled properly. Psychological stabilization is very important. The patient may have more psychosocial trauma. They might be worrying whether the patient has bloody stools, whether my child will recover or not, whether my father will recover or not, mother will recover or not. Most of the time, this will be a worrisome scenario. So, you need a proper psychological stabilization. The indices of that has to be maintained properly. Those psychomotivation therapy is very important to aid this because it's a chronic therapy. As I already been pointed out, if you're going to start on one treatment, doesn't mean that the patient is going to respond to the treatment. So you need to have a chronic follow-up, and all these parameters is absolutely indicated. You should not forget one thing. You are absolutely normal now. For example, I came across a patient who diagnosed in the month of January, for example, in a year, and he has been treated whole duration, and I'm reassessing the patient in November, December, for example, the patient is absolutely fine, no problems. The cut completely improved. And again, within 1 year, the patient completely stopped the treatment, not visited the gastroenterologist again. What happened? Within 1 year or 2 years, we are coming across the same presentation. The patient have more crampy pain, bloody stools. When you're doing endoscopy and colonoscopy, the patient scenario remains more worsened now. Why? Because it's like an autoimmune cascade. Doesn't mean if the patient being treated, the patient will be absolutely normal. The problem with the patient is the patient missed the bus. The patient didn't follow with the doctors properly. That is absolutely wrong. Even if you're being treated excellently, once in a month or once in 2 months, you need to have a proper follow with the gastroenterologist to identify that you're not landing up with any major evidence or presentation. That's absolutely important. Next to that, there is high possibility for the patient to land up with evidence of a problem what's called as dysplastic changes, nothing but cancers. The patient may develop a large intestinal cancers and all those things if the patient is having IBD-like presentation for years. So always you need to screen. That's called surveillance, colonoscopic surveillance. You need to have a proper check of a GI tract once in a year with a colonoscopy as well as endoscopic surveillance to be the better if the patient is going to land up with evidence of inflammatory bowel. So this kind of patients having high risk for cancers to occur. In order to prevent that, always you need to screen even if you're absolutely normal with your treatment. So stick on to the guidelines, follow doctor's advice, have a healthy diet, do good physical activity, properly screen yourself, never be simple, never take life that so easy. If the patient is having alarming pointers, report to the gastroenterologist immediately. Properly assessing the gut is absolutely important. Financial constraints has to be addressed effectively. What are the best of things? We are ready to help the patient. And apart from that, sticking on to the medication is absolutely important, which most of the Indian patients fails to do that. And serial follow-up of the patient is absolutely important to completely make the patient inflammatory bowel disease free scenario in order to give a healthy life, in order to improve the quality of life of the patient, in order to provide a good nutritious source, in order to provide a healthy lifestyle. These are all the things absolutely important to diagnose and to effectively treat. It's a national program. So many things, and world been celebrating this. Not celebrating. We are being having an event called World IBD Day, which is happening in a year. So we need to have a proper assessment of the gut, which is absolutely important in order to protect your life, in order to provide a healthy status to the patient's career. With this, I'm happy to rest my presentation. And whatever the questions from the public point of view, I'm happy to take on with that. Thank you very much. Any questions?
Sir, there are no questions in the chat box, sir.
I'm not very sure. If there's any questions, you can ask me, or else, in case if the patient is having any queries, they can always visit me in Apollo Main Hospitals, Greens Road, Chennai, in order to diagnose this presentation effectively.
Yes. Thank you, sir. Thank you so much for taking time out of your busy schedule to share these valuable insights with the patient. And thank you for your time, sir.
Thank you very much.
Thank you, sir.
Thank you.